Hello there and welcome to this week's CEO Weekly Blog. We continue to share information with you about various activities in the hospital, and in completing this three-part series, if you will, around the work of Community Health 2020 and the activities of Pullman Regional Hospital Foundation in supporting that work, we want to talk about the Center for Women's and Children's Health, which is a part of the Community Health and Leadership Pavilion that we expect to be able to construct over time as fundraising continues forward. The Center for Women and Children's Health is a real important complement to the Center for Learning and Innovation that we talked about last week. It's a complement because it's a place that we might have an opportunity to actually implement some of our innovative, creative ideas that we generate out of the Center for Learning and Innovation. I mentioned last week that we're working with the Palouse Area Health Network, specifically around identifying gaps or needs in women and or children's care. We have the Pullman School District involved. We have Community Action Center. We have WSU Child Development folks participating. We have practices, primary care practices in the community have representatives on the network. So we're drawing from a broader context to understand where are some of these needs. The telespeech project that I mentioned also has a specific focus on school-age children throughout Whitman County. So we've got some ways that we're already making progress in addressing areas of women's and children's health. We've also, you've noticed that here recently we've been sharing with the community recognitions we received this year for some of our work in women's health areas. We're recognized as a Women's Choice Hospital, one of the top 100 of our size in the nation, who are recognized as providing a high level of care and satisfaction to women patients. Now, why are we doing that? What's the reason that we're giving focus to women and children? And it's more than just perhaps a marketing angle. There's a lot of evidence that demonstrates that women are primary decision makers for health care in American families. And so if we can design systems, if we can deliver services in a way that is more conducive to women accessing care in a timely, convenient, time-efficient way, their health IQ, if you will, their awareness of ways that they can manage the health of their families will improve. Their access to those services will be increased. And as their awareness goes up, as their knowledge about the healthcare system and the options that are available expands, they'll have a greater impact on their families, especially their children, but also their spouses or other significant others who also have a lot of their healthcare decisions made by the women in their lives. And so we see it as an important area of focus. There's almost a leverage component to that if we can make positive, significant impact in the health awareness, the health activities of women, then the whole community's health will raise because of their influence through their families, their children, their spouses, and throughout the community as a whole. Now, we're not large enough to only focus on women and children. We're not a women's and children's hospital, but our innovation efforts and our attempts to identify gaps and needs in our community is initially focusing on how can we better meet the needs of women and children as a way to raise the health of the community overall over a period of time. So look for more announcements around the Center for Women's and Children's Health and the activities that we're pursuing and the opportunities that we'll be developing through grants and through other ideas that will come out of the Center for Learning and Innovation. That's the end of our series of three blogs on the Community Health 2020 activities and the role of the foundation in helping us raise funds to support the Endowment for Quality and Access, the Center for Learning and Innovation, and the Center for Women's and Children's Health. Thanks for tuning in, and I hope you choose to have a great day.